Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We had a lot of comments recently about the issues of pediatric issues and diabetes and immune disorders. So I said to myself, where am I going to find the experts? Well, I found them at the Nicklaus Children's Hospital units throughout. We have a diaspora of Nicklaus Children's Hospital units. Of course, you might remember Nicklaus Children's Hospital's main big unit, although people don't want me to say that, is in Miami. Used to be some other name, but now it's Nicklaus. And right in front of me we have Dr. Amy Feldman, who's a pediatric allergist and an immunologist. Welcome.
Well, thank you for having me.
Good to have you. And you're in Boynton Beach.
Yes, that's correct.
Correct? And Miladys Palau,
yes.
Correct?
Correct.
Who is Dr. Mallory Fellow, who is a pediatric endocrinologist. And that's a very interesting thing. And we're going to talk with you about a lot of different issues.
Great.
Thank you very much for being here.
Thank you so much for having me.
Dr. Palau, let me start out because we had a number of questions relative to diabetes. Let's talk about diabetes in the pediatric realm.
Okay, so we have two different types of diabetes, like you were saying, that are more common in children. One is type 1 diabetes, which is a chronic autoimmune condition. Essentially, that's when your immune system, which is supposed to be protecting you and attacking viruses or bacteria, starts malfunctioning for unknown reasons, and it starts attacking the beta cells of the pancreas, which are the insulin-producing cells that we have in our body. And then type 2 diabetes is mostly seen in kids that are obese. They have insulin resistance. One of the signs that it's easy to see in the body is when the kids start getting a darkening of their neck. They can get it under their arms or under their abdomen. That's called acanthosis. So that's a sign of insulin resistance, and that's a risk factor to develop diabetes later in life. So it's mostly based it's due to the fact that they have had unhealthy eating habits, are obese, which is, as you can see, an epidemic now. It's estimated that 1 out of every 5 children is obese in the United States. And the incidence has more than tripled since the 1970s. So it's a big problem that we have in our hands, and definitely is something that we can help our kids with healthy eating habits, increasing their physical activity, to see if we can prevent the diabetes from happening later in life.
I'm going to get back to the subject relative to this issue because we are very focused here at Nova Southeastern now in teaching our medical school students the issues related to nutrition, which relates directly to the issue related to obesity. Not necessarily the body function, but how do you not entice your body into becoming diabetic? So that's more or less an oversimplistic statement. Dr. Feldman, I would say that about 2/3 of the questions that we've gotten relative to pediatric issues has to do with allergies. The common thing, oh, my kid's always sneezing. We go into, they're allergic to dogs, they're allergic to cats. They touch this and they get an allergic response, et cetera, et cetera. It's a very number of questions. Big subject. We probably could stay 2 or 3 shows just on the issue of allergies. But tell me what an allergy, I know what an allergist is, but tell me what an immunologist is relative to allergist/immunologist.
Right, so I'm trained in both allergy and immunology. So allergy focuses more on treating diseases like you mentioned, environmental allergies, food allergies. Asthma and eczema are in that same category too. And then the immunology part is more, we help to diagnose if a part of your immune system is missing or if a part of your immune system doesn't function well.
Let's stay on the pediatric allergies. The most common questions we have, and I know it's oversimplistic because the immunology issues are very well defined and scientific in nature. However, I'm sure that allergies are as well. But like I said, moms and dads, grandmas and grandpas always write to us and ask, what's going on with my grandson, my granddaughter, whatever? They're sneezing all over the place. How can I be allergic to this, this, and this? So tell me.
So it's an interesting question of why certain people are allergic and others are not. So we don't really know exactly the mechanism behind that. We do know that you tend to inherit allergies. So if your parents have allergies, you're more likely to have allergies yourself, but you don't inherit specific ones. As far as environmental allergies, you can be allergic to different pollens, and those are wind-pollinated things. I get a lot of questions about, well, every time I'm around pretty flowers, I sneeze, or can I use bee pollen to cure my allergies? And it's really only the things that are wind-pollinated, so trees, weeds like ragweed and grasses, that can cause environmental allergy symptoms. So the things that are bee pollinated don't actually, the pretty flowers and things like that, don't actually cause allergies. And that's why like honey and bee pollen and stuff like that doesn't actually help to cure your allergies. Yes, you can be allergic to dust mites and dogs and cats and molds and things like that too. So what happens is whenever you're allergic to something, you're allergic to the protein that's in that. So that's true for food allergies, that's true for environmental allergies. With environmental allergies, you breathe in what you're allergic to, so either the pollen or dog dander or whatever. It goes inside your nose and your sinuses, and your immune system overreacts to it. So it thinks that this harmless stuff is dangerous, and what it does is it causes inflammation. So inflammation is swelling and mucus production. So that's the stuffy nose, runny nose, you get stuff that drains down the back of your throat. It also causes a lot of irritation, which can cause itchy nose, itchy watery eyes, and a lot of sneezing. And people with allergies tend to sneeze multiple times in a row too. So in order to figure out what you're allergic to, we do allergy testing at our office. And the best way to do that is skin prick testing. It doesn't involve needles, but it's a little plastic thing that we put on your skin. And we test all the different tree pollens, grass pollens, weed pollens, cat, dog, dust mite, mold, everything that's common in this area. And it's just a little poke on, we usually do it on your back. And then we wait 15 minutes to get the results, but you get the results the same day, and I'll be able to tell you what you're allergic to, how to avoid that. Now, some of that stuff is impossible to completely avoid, but then we can talk about which medications might be helpful or if allergy shots might be helpful for that.
It's a very interesting thing that you bring up, because one of the questions that came from a viewer was, well, you know, we got to know about these allergies, but, you know, I don't want to put my grandchild or my son or daughter, or usually it's grandkids, through this, because I remember when I was going to the allergist, they scratched me and cut me and whatever, I mean, literally cut, you know, yeah. And they had these multiplicity of cuts, and it was more bothersome than having to sneeze. I mean, literally, that was one of the comments that came. So I'm glad you just instructed us as to how oversimplistic, not the technique, rather than the very, very new methodology in which these things are now adjusted for your knowledge. Years ago, they used to send them away, and it would take a week, 2 weeks to get results. I assume that most of that is now available to you almost immediately, correct?
Especially with the skin prick test,
right.
15 minutes in the office. But yes, the devices have gotten much better over the years. So they used to use needles. We don't use needles anymore.
Well, I'm in the last quartile of my life, so you can understand why I say, I talk about that. So, thank you, Dr. Feldman. Dr. Palau, the issue of diabetes came up. Obviously, there were some comments to us about type 1 diabetes, which is as you say, is a genetic or something that comes to you as you are processed and presented to us as a beautiful little child. But it's the diabetes that's acquired. It's the obesity issue that we had a lot of questions on. And people are absolutely shocked, I believe, when they write to us about the amount of diabetes that is being found in children, school kids.
Okay.
So let's talk a little about that. And you can say whatever you want about the food chain or anything else. Just go at it.
So obesity is defined as excessive body fat, right? And with kids, different from an adult, we usually do the body mass index percentile. So the body mass index takes into account not only your weight, but also the height. And we know that, children, they keep growing, and as they grow, they gain more weight. So that's why we use the percentiles as a good measure to see, comparing to kids of their own age and gender, how they fall into this curve. So we define overweight kids above the 85th percentile in terms of BMI, and obese kids above the 95th percentile. What I find interesting is that most of the parents are not aware that the kids have a weight problem. So it's not something that it gets addressed at their pediatrician's office frequently. And not until they do laboratory work and they find high cholesterol or pre-diabetes or high insulin levels that I don't get to see them in my office. So there has been a period of time, probably many, many years, that this could have been addressed and could have probably been prevented if they would have followed healthy eating habits and increase in physical activity. So I think one of the things that we need to encourage parents and grandparents when they go to the office visits is ask, what is my child's BMI? Is he at risk to become overweight? Is he at risk of being obese? Because we know that once kids are obese, they have a higher tendency to be obese as adults. And with obesity, we get a lot of more medical conditions such as type 2 diabetes, heart disease. They can have multiple cancers that have been associated with obesity. So definitely, establishing what I call healthy eating habits. I tell my patients, it's not that we're putting you on a diet, it's that you're changing your lifestyle. So, for example, I'm Latino, I love my rice and beans, right? But it's always about portion control. So I tend to do a smaller portion. And, a good way of doing it at home is as simple as the size of your fist. So when you're serving yourself or you're serving your kids, look at their size of their fist, and that should be the amount of carbohydrates their plate should have, so like the pasta or the rice. And then if they look at the size of the palm, that's the size of the protein that they should have. And then make sure that every plate has like a good serving of vegetables so that they get full, not with the carbs, which is usually the most yummy stuff, right? The pizza and the pasta and the rice, but with more, fiber-rich foods, just like vegetables.
One of the things that I've noticed is that the carbonated beverage manufacturers have gathered up together to reduce the size of the containers and also the elements of, shall we say, the amount of carbohydrates that are in there, whether it be sugar or whether they be the I don't want to get into the science of it, but the sweeteners which act almost the same way relative to stimulating the body to do what it has to do to protect itself. Correct?
Correct. So that's one of the first things that when patients come into my office and I see them for obesity or insulin resistance, or like I said, they had the darkening of the skin, which is a sign of prediabetes. That's one of the first things that I ask them to eliminate is all sugary beverages. So, gaining weight is extremely easy. Usually it only takes an extra 100 calories a day that you did not burn off for you to gain a pound a month, which tends to be like 10 to 15 pounds a year. And when you look at a juice box, it's usually anywhere from 100 to 140 calories. So in children, just by avoiding the juice and the sodas, they can have a significant weight change and start, decreasing their weight just by avoiding those sugary beverages. And I think people have to be aware of all the things that have sugar, right? Because I asked, do you drink juice? And they're like, no, we don't drink juice at home. But then you ask them, do you drink iced tea? And then, oh, yes. So, right, the juice, the soda, the iced tea, the lemonades, the sweet tea, anything that has more than 0 calories, it's definitely containing the sugars. Those that have 0 calories, just like you were saying, the diet, they have artificial sweeteners. But in a sense, you know, sometimes they tend to increase the craving for more sugary stuff. So it's always a little bit, you know, it's hard to balance, right, which one you want to go for. But that's why I always tell them stick to water. And that would be, you know, my best advice is when you have to drink something, just drink water.
Dr. Feldman, as an immunologist, we were talking recently we had a show on nutrition and advocacy. These were people that actually were medical doctors that had also, they were involved in the field of nutrition. And they were talking about the laxity of individuals to read labels when they buy things. And I'm not talking about picking up, you know, vegetables and even meat products if that's what they want. But it's the labels. They don't read the labels. They don't see what's on there. I would assume, and this is just an assumption on my part, that as an immunologist, never mind as an allergist, that there might be a lot of these products or substances, chemicals that are in there, that people are potentially sensitive to, if not almost beyond sensitivity. True?
We don't have good data on that. There are some people that feel like they have sensitivities to different preservatives and things like that. We don't have good tests for that either. So a lot of that it's a little bit more difficult to figure that part out, because if you tell someone to do a preservative-free diet, that's a very, very difficult thing to do, because preservatives are in almost everything. So, and you know, they even spray produce at grocery stores with preservatives. So in order to do completely preservative-free diet, you have to go to farmers markets only, get fresh produce. I mean, it's a very healthy way to eat. It's just very difficult and a lot more expensive for some people to do. But that's really the only way that you could tell if you have one of those sorts of sensitivities. It's not a true allergy. A true allergy is a different sort of thing. And I kind of briefly talked about true food allergy before, and that's when your body recognizes the protein in it. So it would be separate from a chemical type sensitivity. But a true food allergy is when your body, so if you think about it, you're putting foreign stuff in your body all the time when you eat, and your immune system has to figure out, is this dangerous or is this something I should ignore? So it's a very complex relationship of what happens inside your gut. We don't completely understand it. We think the microbiome has something to do with it. Lots of different parts of your immune system have to do with it. But when that doesn't work properly, when something wrong happens, your body recognizes food as something foreign and dangerous. And that's when it creates allergy antibodies, which are called IgE antibodies. And they float around in your blood, and then the next time you're exposed to that protein, it says, I recognize this, and then it causes symptoms pretty quickly after you eat it of an allergic reaction, and that's hives, swelling, difficulty breathing, throwing up, stomach cramping, diarrhea, all that stuff.
Let me ask you this question, because it actually happened. I mean, I usually don't talk about myself, but it happened to me. Late life allergy. Out of nowhere. I mean, I ate shrimp products all my life.
I was about to ask if it was shellfish.
No, it wasn't. You know, it was a shrimp product. I mean, I could still eat lobster today, but all of a sudden I ate a shrimp product and I went into a near anaphylaxia. In other words, all of a sudden I couldn't breathe. I mean, the whole story. I mean, I was on different products immediately. It reduced my response, but it was very frightening.
Yes, it can be very.
It was
scary.
late life. I mean,
So it's very unusual for you to have a food allergy that happens later in life. Almost all food allergies happen in the first year of life, really, and that's like peanut and all that kind of stuff. The only exception to that rule is shellfish. We don't really know why, but you can develop a shellfish allergy at any point in your life. You can be, in your 60s, you could be in your 30s, and you can suddenly develop an allergy to it. Now, with shellfish, there's two big classes. There are the mollusks, and then there are the crustaceans. Shrimp, lobster, crab, those are crustaceans. They cross-react with each other, but they don't cross-react with the mollusks. And that's stuff like the bivalves, like oysters and clams and scallops and things like that. So that's probably why you have a problem with shrimp, but you are fine with some of the mollusks.
Again, I don't mean to personalize this, but ever since it happened, I get this number of people that have told me, gee, all of a sudden out of nowhere I can't eat X or Y. And I said, that's really very odd to me, but I'm glad that you attested to the fact that it happens.
Yes, yours definitely sounds like a true food allergy, but a lot of times people will get food intolerance, which is a different mechanism in the immune system. And that's like a good example of that is lactose intolerance, and that can happen on later in life. That's when your body doesn't have the enzyme that breaks down lactose, which is a sugar in milk. So when that lactose goes into your gut, your body doesn't know what to do with it. So it rushes water into your gut, and it causes diarrhea and cramping and gas and that sort of thing. But those are different symptoms from a true food allergy.
What is it's almost a silly question, but I want to ask it anyway. What is the most common pediatric allergies that present to you?
Including environmental and food allergies? I'd probably say peanut allergy.
And I've seen a peanut reaction. It's violent.
Peanut tends to be one of those that you can have a more severe allergic reaction. The reaction that you had to shellfish would be very similar. So what we say with any food allergy is any food allergy can have that same severe allergic reaction, which is anaphylaxis. The good news about food allergies is that you have to ingest it in order for it to cause that severe allergic reaction. So a lot of people worry about being in the same room with peanut or something like that. It's not airborne, that protein is not airborne. So just being around it won't cause you to have a severe allergic reaction. It can if it touches the skin. So if you're at a table and there was peanut there before and you touch that table, you can break out hives. But again, that won't progress to that severe allergic reaction.
Well, we're down to the last 5 minutes of the show, and there's so much to talk about. I apologize, but the most common question that comes from the viewers is about, usually, like I said, it's their kids and grandchildren. And they're always talking about runny nose, sneezing, sometimes asthma issues. Is that the most common thing you see?
I probably see more food allergy than environmental allergies, but I see a lot of environmental allergies too. And South Florida tends to be, people are more allergic to more of the year-round things because we don't have very distinct seasons here. Right. So I see a lot of dust mite allergy and a lot of cat and dog allergy.
And pollen?
Pollen I see, but just not quite as much.
Right.
Because those have more distinct seasons.
Are they easily controlled with certain medicaments?
It depends on the person. Some people, they just take an antihistamine on a daily basis and they're fine. But some people take nose spray, different pills, and their allergies still aren't well controlled. So for those people and for people who just hate taking medicine on a daily basis, we can do allergy shots. The way that's different is that we test you for what you're allergic to, and that's what we put in the shots. So it's not actually medicine, it's the stuff you're allergic to. And then we inject that in your body, which sounds crazy, but we start out with small amounts and build up, and that helps you to build up a tolerance to those things. So the big deal about allergy shots is that, number one, it's all natural, but number two, it can actually cure your allergies.
And Dr. Palau, like I said, we're down to the last couple of minutes, but I want to talk very quickly about caring for the diabetic pediatric patient. Are we still in the era of pharmaceutical control, or just both pharmaceutical and food intake control?
I think one of the exciting things about treating patients with type 1 diabetes, for example, at this moment is the fact that we can offer more therapies, and technology has been a big a big game changer in how we treat kids with diabetes. So it used to be the case that kids would only be able to do insulin shots, and usually, depending on the regimen that they're on, it can be anywhere from 4 to 6 or 8 insulin shots a day, depending on how much they eat. But now we have an insulin pump that is able to provide insulin on a constant basis. And then when the patient wants to eat, it just tells the pump, I'm going to eat this amount of carbs, and this is my amount of blood sugar, and then the pump can calculate how much insulin to give. Also, now we have continuous glucose sensor monitors. So those are devices that are sending the patient constant information about their blood sugar. Every 5 minutes they get what is their blood sugar. And it's good because it can alert the patient, the parent, if the blood sugars are too high or if the blood sugars are too low, for them to be able to fix that problem. And I think the most exciting part of those novel technologies and therapies is the fact that now they're able to communicate with each other. So now the sensor can send the message to the pump, and the pump, depending on the computer algorithm that it has, it can calculate the rate of how fast the blood sugars are rising or dropping, and then determine whether it needs to give more or less insulin to the patient. So in terms of type 1 diabetes, we definitely have come a long way since insulin was invented in the 1920s. And with type 2 diabetes, I think part of my job is try to prevent from the patient ever developing type 2 diabetes. And, a lot of anticipatory guidance about the healthy eating habits, the importance of exercise. I think that's the key to be able to, tackle, so that we don't have to deal with the type 2 diabetes later.
Okay, thank you. There's so much more to talk about, but we're out of time.
Thank you.
But I want to thank both of you, Dr. Mallory Palau from the Nicklaus Children's Hospital, and you're a pediatric endocrinologist, and Dr. Amy Feldman. You're a pediatric allergist and immunologist, and there's so much more to talk about. We're going to have you back, all right?
Thank you.
Thank you.
And we wish you well. You're in Boynton Beach?
Yes, that's correct.
Right, and you are in
Palm Beach Gardens.
Palm Beach Gardens. So anybody wants to reach you, just figure out a way to call Nicklaus Children's Hospital. They'll tell you how to reach Dr. Palau and Dr. Feldman. Folks, I hope we answered your questions. I always tell you, you got to talk to your physicians. If you have a question about your child, talk to a pediatric physician. Make sure that they get them to either Dr. Palau or Dr. Feldman, because they're the specialists in the area that you have asked questions about. Remember, this program is called Dateline Health. If you have any questions or you want any answers, the email address is right here. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.